the focus on Manchester. So Manchester practices were invited, and I know the invite went out late. It went out, I think, on Wednesday last week, and I know the time of year is very busy, but we decided to go ahead with it anyway because we could record the session and send it out to practices that weren't able to attend. Today, we're going to be focusing on making eConsult work in your practice, and I'm aware that some practices that registered don't have eConsult at all. So I'm going to hopefully cover all bases. Obviously, there is more that I could say, and you probably will have questions. So please feel free to ask your questions in the question section at the right. My colleague is online eagerly waiting, in fact, to answer your questions. So how you make eConsult work in your practice. I'm joined by my colleague, Cara, who will be one of our senior implementation specialists. Their role is to help you implement eConsult in a way that works for you as a business. I'm Stella. I'm territory manager for all of Manchester, and we're in the process of finalising our contract for Bolton practices. And my understanding is, yes, it's the end of the year, but you have some time to implement eConsult if you choose to come over to us. So I'm just going to start now. So I'm going to start with an overview of eConsult, and there are many things I could tell you, but today I want to focus on the 4 things that are highlighted in bold. The first is eConsult is designed for remote closure. We say that because what we want to happen after we send you the eConsult is for you to be able to review that consultation and in some cases close off the consultation without needing to speak to the patient. So our questions mirror questions that would be asked in an ideal face-to-face consultation. The questions are set by a clinical governance group of NHS clinicians, and we have over 130 named conditions. So if a patient presents with headache, we ask them about the questions that a clinician would ask if the patient was in front of them about their headache. And then we have women's problem templates, mental health, and we've got peds, but we'll talk more around that. But that's one thing I want you to remember, that eConsult is designed for remote closure, and this is where practices can save time if you're able to get all the information up front. It gives you a better position to triage that patient or to complete complete their request that first time. And then it enables federated working. I know that we've got, in fact, I think it was last week, we did a webinar on eHubs where we got the first NHS Blueprint PCN to come and discuss how they implemented a hub using eConsult and our smart inbox. The other thing I want to highlight is eConsult enables effective care navigation. We know that the push for general practice is that all patients should be triaged that first time. So you shouldn't be sending patients away when they call at 8 o'clock and ask them to call later. What we want to do is provide you all the information up front so that you could care navigate the eConsults and so that patients can be seen in the right place and at the right time. The other thing we do is control volume. So we've got settings that enable you choose when you have the service available. The service is available by default 24/7, but you could choose to have it on just when you're open, or you could choose to have it on just in the morning because you want to deal with today's work today. We also have other features that enable you snooze the service if somebody critical has gone off sick. And of course, you can set your cap as to the volume you can deal with each day. So just to give you a very quick overview, patients or proxy can complete an eConsult either from the NHS app, from your practice website, or something we call Practice eLite. This is a slimmed down version of eConsult that enables reception team complete an eConsult on behalf of a patient. The reason we do this is because we want to mirror the modern general practice model that says every patient should be triaged in the same pot, whether they came through online or whether they came through on the phone. eLite is an optional feature that you can use. So that's something that will be available for free as part of the package. And then when the patient starts their journey, we have self-care option, pharmacy option, and then we have local referral services. So, for example, if a patient presented with mental health, we will offer them the Greater Manchester Mental Health self-referral service so they can self-refer themselves. And I will talk a little bit more about local services shortly. As the patient continues their journeys, one of the things we do at the very beginning is get the patient to confirm that their presenting complaint is not an emergency. And I know as a non-clinician, if I can't breathe, I'm never going to go to my practice website. But I know since doing this job, there's some conditions that only a clinician can tell you the urgency. So for example, if you have a headache and you have lower back, for non-clinicians, they will tell you that's not an emergency. But I now know that actually that could be something more sinister than just a headache. So we've got red flag features built into the software. So we don't rely just on the patient saying it's an emergency, it's not an emergency. But I will talk a little bit more about red flag features. And then when the e-consult comes in, we say it should be triage. It shouldn't just be given to a GP. That's what practices used to do back in the days. But now we've got other clinical staff in the practice. We've got reception or administrative teams that have been trained to care navigate effectively. So we say it should be given to your triage team, which could consist of care navigators, pharmacists, admin, physio, and so on. In fact, the GP, we say, should be at the very lower end of the pecking order, because we know that the demand for general practice is at all-time high. And also we know that it's actually very difficult to recruit GPs and they're not enough in the system. When the e-consult is reviewed, we find that about 40% of the e-consults are closed off without a secondary contact. This is because we know that the information that we give to you up front enables you to deal with that e-consultation. In some cases, 40% of the time, not needing to speak to the patient. So those could be closed off just with a message back to the patient, or providing self-help, or just sending a prescription. And then about 40% will need a video consultation or a telephone call. But even in those cases where a subsequent interaction is needed, we know that that interaction is a lot more efficient, because you know exactly what you want to ask the patient when you call them back. Or if you invited them down for a visit or a face-to-face visit, you know exactly what you want to examine. And of course, in some cases, clinicians would like to order a blood test first before even needing to interact with the patient. About 20% will need a face-to-face. So like I said at the beginning, what we're trying to do is enable remote triage, i.e. provide you enough information so that you can close up those consultations without needing to speak to the patient, knowing that we have clinical safety features built in, which then means that we will never send you very sick patients. And also we will highlight areas that we want to draw your attention to. And I will show you what all this looks like when I demo this Martin box. So moving on, the next area I want to just touch on briefly is our clinical safety features. So two things I want you to remember about e-consult. The first is that it's created for remote management. The second is the clinical safety features built in. I said earlier that when a patient starts their journey, and every online consultation tool will get the patient to confirm their presentation isn't an emergency. But we know that it is inept to rely on a non-clinician to tell you the emergency or the urgency of their presentation. So we allow them to tell us the answer to the question, is it an emergency or not? But we don't rely on the fact that they said no. And I thought it'd be useful just to give you in terms of numbers what this looks like. So in a month, we get about 1.5 million e-consults. And at the start of the journey, about 18,000 patients will say it is an emergency. We call this pre-consultation diversion. So we haven't started the consultation, but the patient has said it is an emergency, and we offer them appropriate guidance on what to do next, which would typically be go to A&E or call 999. The rest of the patients will say, no, it's not an emergency, but another 14,000 will go on to trigger an emergency red flag. So these are patients that shouldn't have started on the journey at all. Then we have what we call urgent symptoms. And by the very nature of the condition, it doesn't mean that it's urgent, but because they're presenting online, There are risks attached to anything medical, even if the patient was in front of you in a face-to-face consultation, there are risks attached. So we err on the side of caution when patients are starting their journey online. And there is some piece of work we've completed which enables some practices, if they choose to get the urgent redirects. And I will talk a little bit more about that when we go into the Smart Inbox demo. And for those consultations that come through to the practice, we have what we call in-report flagging. So in the report, we highlight questions that we want to draw your attention to. So the questions mirror questions that will be asked in an ideal face-to-face consultation, but what they're flagging in the report is trying to do is draw your attention to areas we don't want you to miss, which would then increase the efficiency of you reading that report. So moving on, local services is something I highlighted earlier. This enables us to add different services. On the screen, you can see we've got one for built-in talking therapies. So we can add different services to your eConsult system so that if a patient were to start on a journey where a self-referral service applied, we could signpost patients to that service, which then means they don't have to complete an eConsult, which is sent to your practice, for you to then tell them to go and self-refer themselves. And the one example we've got on screen is mental health, but we've got others for physio. You may have others for physio in Manchester, ophthalmology, sexual health, or even sleep problems. So I'm going to start with a poll, and the question is, would you like to have local services added to your eConsult account? The options you have are yes, please, why not? And then I think I already have them, or you need more information. I'll just give you a few seconds to complete that. Okay, so now I'm going to move on and hand over to my colleague, Cara. I'll stop sharing my screen so Cara can go through with you the use cases and models.
Thanks, Stella. Let me just share my screen, 2 seconds. Hopefully you can all see that all okay. Perfect. So in regards to today's example models that we wanted to run through, there's 3 main ones. So you have the total triage model, which has become a very popular model for a lot of our practices recently in the upcoming changes. So this one is where you kind of introduce eConsult as your main route for accessing help or for an appointment for your patients. You'll then have the same day model, which is introducing eConsult as the main route, but for accessing help or an appointment on that same day. And then you have the routine model, which is the most used kind of model that we see. And that's when you introduce eConsult as the practice's preferred route for accessing help or an appointment, as they may not need a face-to-face appointment. And as you can see, there are benefits for all 3 of the models, and I won't go through all of the different ones today. However, some of the benefits for a total triage model could be that it's an easier model for your patients, but also for your practice once implemented. It means patients do expect a quick response when using that digital route. And then for the same day model, it can mean that patients expect a quick response when using digital, but also improved access for patients and less pressure on your phone lines. For that routine model, some of the benefits could be, again, improved access for your patients and less pressure on the phone lines, but also patients are seen based on clinical need, not clinical want. So in regards to some of the kind of processes that are available and that we see practices utilising, so you have process 1, where it's kind of a mixture between admin and clinical. So you'll have admin review and triage any of those incoming admin eConsults. And then you'll have your clinicians reviewing and triaging those clinical eConsults that are coming into the surgery. Process 2 is more of a kind of clinician based. So you'll have clinicians review and triage those incoming eConsult and only task admin eConsults with the admin team. You then have process 3, which is kind of a mixture dependent on who is available and dependent on your practice and who's kind of going to be around or the skill sets that are available. But you can have a mixture between clinicians or admin reviewing and triaging those incoming e-consults, and then the clinical and admin team action the relevant ones when necessary. And then lastly, you have process 4, which is kind of the care navigator, reviews and triages those incoming e-consults, clinicians support with the clinical e-consults, and then you have the admin team actioning and reviewing those admin e-consults. We can support you with these processes, and if you want advice or more detail on other practices that are kind of using these processes, then reach out and let us know. You also have areas like the long-term condition review templates that are available. And depending on those processes or models that you choose from, you can be pushing specific templates towards your patients. So you could be pushing other templates, but specifically for the long-term condition templates, this is where you have kind of practice-initiated questionnaires. And you could be texting or emailing a link to these review pages to specific cohorts of patients. And then you can be asking patients to complete these, whether it's for QOF or just for you guys to have in place prior to that. But it provides patients the opportunity to start and finish their annual reviews online. And it also means that you're saving a lot of time for your nurses with efficient triaging and patient information being gathered upfront and beforehand. We have over 15 different templates that are available. And if you want to have a play around and see what's available, you can do so via our demo site. So on to another poll. We're going to just ask you guys if you'd like any support with how you can best utilize the long-term condition templates. And the answers that are available are yes, please. Not right now, but please message in a month. Or if you're not sure, we can also send more information. So we'll give you a few moments to let us know. And then we'll move on. Perfect. So I think lots of responses have come through for that. So just quickly, we wanted to highlight as well the importance of understanding your data. So if you are an eConsult user or maybe going to become one, it is important to know what your data is saying. So we can send out usage reports, and that can be weekly or monthly reports, and they can be sent out to a specific member of the team or multiple members of the team, dependent on your processes in your practice. They are available in an Excel format, so it's manipulated into a format that suits your needs. But it is important to understand what your patients are doing and what options are available and where they may have been signposted to. And you can review all of that within the kind of the report itself. You also have filtering via the Smart Inbox available, and that can be for the date range or the condition. But we've also linked here the article that we've written with additional information on your usage report and how you can understand that data. Over to you, Stella, for the Smart Inbox demo. I'll just stop sharing my screen.
Thank you, Cara. I'm just going to quickly log into the Smart Inbox and now share my screen. Cool. I'm aware that the size of the Smart Inbox is quite small, but if you need further information, if you want to have further discussion around this, I'll be very happy to have a one-to-one with you. So this is the eConsult Smart Inbox, and this is the way that you would receive eConsults that have been completed by your patients. Just going through it from the top left, you can see that I'm a member of BOL practice. So BOL is my practice. But also, my practice is a member of a hub, and we went through this in detail in our eHub webinar. So the system allows you to process eConsult in one site, but also enables, if you choose, PCN hub or Federation hub to process eConsult for the other practices. And it could be that you have, say, a pharmacist working in the Federation and you want that pharmacy to support all your practices within the PCN or Federation. So that option is available. On the right-hand side, you can see that I am the user logged in. Going now to the left, you can see that what we call the navigation pane, where you have the different folders. At the top, we've got the all open folder, and you can immediately see you've got 28 eConsults not yet closed off, and there could be at different stages of processing. Flagged urgent is what I talked about at the beginning. So we talked about the emergency redirection, where patients deposit information that we believe they shouldn't come through on eConsult. In fact, they should be calling 999 or go to A&E. And then I have the urgent redirects that may not by default be urgent, but because we don't have the patient's notes and we don't know the patient, we err on the side of caution and we get them to call the practice or call 111. And some practices have said we would like to receive those because we have a system of processing eConsults on the day. So it's a lot easier for us to get their completed consultation than the history that the patient will provide when they call to say eConsult asked you to call me. And just as an example, my mother is she's got high blood pressure, and sometimes her blood pressure is too high for the system to accept. But when we speak to the doctor is happy with the blood pressure because for her that is normal and they're aware about her high blood pressure. So that's just one example. We've got complete, and then we've got failed messages. So via the Smart Inbox, and I will show you that in a minute, you have the option to text or email a patient. And if that fails, that eConsult will go into the failed messages. So we show you in a very easy way that what message you thought was sent didn't actually go through. So you can easily go back and resend the message or perhaps amend the details you want to send the message to. I will come back to tags, but I will go now to our two big folders, which are the clinical folder and the admin folder. So by default, all the eConsults that come through will automatically be separated into clinical or admin. So all the clinical eConsults will go into the clinical folder and same for admin. Within those two big folders, we have similar folders called the waiting. So all the new eConsults will go into the waiting folder. Snoozed, you can choose to snooze or lock an eConsult to your name because you want to come back to it at a later time. Awaiting patient response, like I said, you can send a message to a patient and you can allow them to reply to your message. And if you enable that feature, that eConsult will go into the awaiting response. New responses, as he says, when the patient replies to your message, that eConsult will go into the new response. And then we have triage. The way that these folders work for you will depend on how you choose to use eConsult in your practice. So now the similar folders we have in the admin folder, so I wouldn't go through all of them. But going now to the right, you can see the individual cards. At the moment, I've got 8 in the waiting folder, or I've got 3 rather. I've got 8, sorry, in the clinical folder, and you can see each of these cards represent an eConsult from a patient. On each of the cards, you can see the name of the patient, their sex, and their age. You can also see what presentation they've come with. So we talked about long-term reviews. This example here is a diabetic review from a patient. So the process for these consultations is different to the way that patients will normally access eConsults. So for normal eConsult, the patient goes online and they start the consultation. But for the review templates, the use cases, the practice will send a text or an email with a link of the relevant review and send those to the patients that are due a review to complete. Once that's completed, it goes into the Smart Inbox for you to review. So on the review template, you can see all the information. Like I said, all the information we ask are questions that you would have asked or you should have asked if the patient was in front of you. I'm now going to go to the hypertension review template to highlight the fact that the patient has the option to present or provide their hypertension review. They could provide more than 3. In this case, they've provided 3. And on the right-hand side, you can see that the system has calculated their average blood pressure over the period that they've submitted. We also collect their weight and height and then calculate their BMI, which helps you when you're doing your review. I will now go to another hypertension review template. In this example, the patient's presented 4 reviews. On the right-hand side, you can see the average. We have their weight and height. We also then have the BMI calculated, and then the reviews have been answered as we expect them to. I will talk a little bit more about the red flags when we go to the in-report flagging that we talked about when we go to another when I review another template. But for now, just to say that we've added amber flags to the areas we want to draw your attention to. So this is a review template. The patient is 30.5 BMI, which is obese. And then scrolling down, there's another flag that says that they smoke 20 to 39 cigarettes a day, which is, of course, excessive. So we want to draw your attention to it. Going now to another e-consult, I'm going to go to, there was some I prepared earlier, so bear with me. I'm just going to sort it by, it's automatically sorted by time received. So I'm going to change that to newest to oldest, because I want to see the ones I just did recently. So the other one I did was rash, spots, and skin problems. This e-consult, at the top of the e-consult, you can see the name of the patient, the age. So this is a child, and you can see the time it was submitted. You can also see it was submitted by their mother. It tells you when the patient is expecting a response, and it tells you that there is a plus sign. This indicates the urgent redirect. So if your practice was receiving urgent redirects, this e-consult will come through. And the helpful thing is we tell you which exact question triggered the urgent redirect. And in this case, it's for rash. And it says, does the rash look like red, brown pinprick spots, or the reddish purple blotches similar to bruising? And the answer is yes. So that triggered an urgent redirect. And at the bottom, you can see a picture that's been submitted by the mother. And if you click on the picture, the image is enlarged, which then gives you a better view of the rashes that the mother is presented with. So I'll jump out of that one now and go to depression. In this example, I want to highlight that every e-consult that comes in, what the Smart Inbox will do for every e-consult is immediately find that patient in your clinical system. I know that most practices in Manchester use EMIS, but it works the same for EMIS and for System 1. So the system has automatically matched the patient. And in this case, it didn't match the NHS number because usually patients will know their NHS number. If you wanted to, you could open the patient's record and manually match it. But in this example, I'm happy with the matches that the system has returned, and I will let it be. So then I want to highlight the integrated scoring that we have in eConsult. In this case is mental health. So of course, PHQ-9, sometimes GAD-7 where relevant, is embedded into the report that we send to you. And you can immediately see this patient is moderately severe, has moderately to severe depression and has a score of 17. Again, you're informed as to when the patient is expecting a review, and it tells you that the patient, this eConsult, has red flags and amber flags. The structure of the report is the same, which helps when you are reviewing volume. So once you've done a few eConsults, you'll be very familiar with the layout of eConsult. It always starts with the ICE questions, the ideas, concerns, and expectations. This is where we've asked the patient, as a normal consultation is structured. When I go to visit my doctor, the first thing that they say is, good afternoon, Stella, how can I help you today? And then they allow me to tell them about my problem. And then the doctor goes into a more structured and closed question set to ensure that there's nothing more sinister than what I've presented with. And this is how the consultation is structured. On the left-hand side, you can see that we've added symbols to some questions. And in this case, we've got the speech bubble, which indicates where patient is written in free text. And if I scroll down to the end, you can see there's an amber flag, and the question is, would you be interested in CBT? The patient has said yes. This is useful when you're reviewing the eConsult. And then the next amber flag is, do you smoke? And the patient smokes 40 to 70, above 40, not 70, hopefully, cigarettes. So going down to the bottom, you can see, hopefully, that you can respond to a patient. So you could choose to, it's defaulted to email. You could choose to send a patient an email, or you can change it to send an SMS to the number they've just provided, or you could send to a different number. When you're writing your message, you could use one of our templated messages where we've pre-written text for you, or you could write your own message and save it for next time. And you could add an attachment. You have the option to allow the patient reply. And if you did, a link will be sent to the patient to reply within 7 days. So I'll cancel that. So that's this. Yes, discard, bear with me. So that's the Smart Inbox. I've reviewed the eConsult. I'm now going to go onto the left-hand side to Signpost. Now, this is where the different processes come in. Like Cara said, they're different processes. You could have admin team doing the initial triage, and then the clinician going in to close off the ones that have been assigned, maybe to a pharmacist or to the nurse or to the GP, depending on how you work in the practice. Or you could have trained admin team, care navigators, to care navigate, or a clinician could log in to triage the eConsult. Whichever process works for you, the Smart Inbox would fit your own procedure. So on the right-hand side, you have the option to choose what team the eConsult should be triaged to. You have the option to choose the urgency, so you can determine whether it's one for today, tomorrow, or for next week. You have the option to also add the mode, so it could be something that you want to do face-to-face, or you just want to send a text message to, or you want a video call. The type is clinical, and then you can change the status so that you change it to triage if you want somebody else to come in and triage and complete the eConsult. Or you could just complete the eConsult here and add the patient to the appointment book. If I change it to triage, that eConsult will leave the waiting folder and go into the triage folder, which is helpful if somebody else is coming in to do the final triage, they just go into the triage folder. One of the things I said here is at the top, you can choose a team, but you may choose to tag a specific person. So it could be that you want it to be looked at by a GP, but you have 4 GPs. So which GP do you want to look at this eConsult? You could then go to the left-hand side and add a tag. And these tags act as folders. So you could tag a person, or you could tag a service outside your surgery. So it could be one for CPCS, so that the admin team, when they go in, they can then process the eConsults, all the eConsults for CPCS. Or it could be for a social prescriber. It could be that you have a social prescriber in-house, or one that is shared by the PCN, and therefore they can go into that folder and process all the eConsults that have been assigned to them. One of the benefits of the Smart Inbox is you can collect the QOF codes for the relevant information that the patient is presented with. So in this example, we have a depression. So the patient is a smoker. We've provided a QOF code, SNOMED code for that. This patient is also an excessive smoker. So we've sent them the level 1 smoking cessation guide, and we add that code to your Smart Inbox to enable you add that to your QOF points, which will help you get those extra points and extra money. The other thing to highlight in the Smart Inbox is the ability to add a note. So you could, the notes, if you think now about different members of staff, they might be working in the same building, or they might be working across sites. One person may be at home, or one person may be in a hub. So you can use this box to write something instructional. Maybe you want the receptionist to book an appointment, or you can say why you have chosen the options that you've chosen. When the next person comes in, all the activity that's gone in on the eConsult will be viewed and can be seen by all. With all the eConsults, you have the option to save to record just by one click. And when you save, all the information, the PDF report, the activity logs, the messages you've sent will be saved to your clinical system. So your clinical system will become the source of truth, and you don't have to keep coming back to the Smart Inbox to find out what happened to the patient. To save to the record is one click, and it literally takes seconds to save everything to the patient's record. It's already saved. You can see there the pop-up come up. When we save to the record, we will save the ICE questions separately, which is like a summary of the request, of the patient's request, and then we'll save the PDF document separately, which then allows you to go into more, open it and look into more detail if you choose. Final few things to highlight in the Smart Inbox is what we call eLight, and I talked about it just at the start. Like I said, we're trying to give you a general practice. We're trying to give you the tools to help you run a new modern general practice model, which means patients that present on the phone, you have the option to collect pertinent information of them so that the clinician reviewing the consultation will have more than just one word that would normally be taken if it was on the phone. So if I call my practice, if I do get through and they do take my details, then they ask me what the problem is and I might say headache and that's it. But with an eLight, you have the option to see a lot more information. And I'm just going to go to a sample eLight here that a parent completed on behalf of the child. This child is 10, they're male, and is completed by their mother, aka me. And then you have the ideas, question if they would like a specific clinician. That's an option you can choose to switch off. Some practices like it, some don't. And then we have the questions which say, can you tell us why you were unable to use eConsult, which is useful for educational purposes? How can we help you? When did the problem start? Have you tried anything already? Is there any particular help you like? And then the staff member has the option to add a flag if they think that this is one of the things that should be dealt with first. So finally, you can sort, when you are processing eConsult in the Smart Inbox, you can choose to sort it. I sorted it by time received, so oldest to newest, but I could also sort it by age. So I may want to deal with the children first because I know that they usually will need an appointment in the afternoon, or I may choose to deal with the elderly. Or I may choose to process the ones with the most flags because they may need a subsequent interaction. So it's up to you how you use the Smart Inbox, but there's training available to help you implement eConsult in a way that works for your practice. Last week, we had a session on how to use eConsult to meet your access target. That was for Wales practices, but the principles are still the same. And in that webinar, one of the GPs said that they actually reduced their locum cost by 80%. And another practice that joined us on stage said that they used eConsult to help them reduce their waiting time for medication review appointments. I think that is the end of the whistle stop tour. There is a lot more I can say, but time's not permitting. So now I'm going to stop sharing and hand back over to my colleague, Cara, to go through marketing. As she's trying to share her screen, I think I will just add that it's really important when you start your service to let patients know about the service, and Cara will go through the most efficient ways of marketing.
Perfect. Thank you, Stella. So as Stella mentioned, as soon as you've kind of decided on your models and your internal processes for how you're going to be managing those incoming e-consults, there's 4 main areas that we like to highlight to our practices for shifting patients online. So the first one is via crib sheets or scripts and kind of via word of mouth. So active signposting towards the eConsult platform from all of your colleagues. And it is important that everyone's on the same page so that patients don't use that as a way to kind of get around that system and speak to a different member of the team that may let them through. So making sure that you're having those conversations with patients that are calling the surgery or patients that are in kind of an appointment already and informing them that this option is going to be available to them or that is available to them. And we have those crib sheets and scripts available so that you can make sure that the right kind of use of language is being used. The second one is text messages. So you can be using regular SMS messages to text specific cohorts of patients. Instead of sending out messages to all of your patients, you may want to gather groups of cohorts of patients. For instance, a certain age group or specific condition patients. So if they were asthmatic patients, you may want to gather that cohort of asthmatic patients and send them out a link for the kind of asthma review template, for example. You can include a link to those specific templates in the text messages, or you may want to be just sending the link for your practice website so that patients can go onto there and see the different options that are available to them. The third option is website. So making sure that you have a prominent eConsult banner on your landing page of your website, so it's easy for your patients to find the eConsult platform. You can also include additional information as well as the banner, and that's how your patients will access the eConsult platform. So that could be guidance, any information. It could also be a video just explaining what the platform is and how it works, or any additional areas that you think would be useful for your patients. The fourth option is a telephone message. So typically that is how your patients have been accessing the surgery and how they book in an appointment. So making sure to record a telephone message, letting your patients know about eConsult is really important and crucial if you want to make that shift for your patients. So as I mentioned, those reception scripts that we have available, you can create scripts for your team yourself to encourage your patients to use the platform, or you could use the ones that we've created and that are available, and we've linked them here. So just to highlight again, it does encourage patients to complete an eConsult. It creates a consistent message as well, like I said, making sure that everyone's on the same page with the same sort of idea for what you're pushing your patients to do. You can also be educating and informing patients for future use, or for if they ever need an appointment in the future, they then know that this option is available. And you can also utilize them to upskill and support your team. In regards to those text messages, engaging your patients via text message campaigns is important, and there's some ideas for how you can do that on this slide here. So like I said, you can target specific age groups, but you could also be kind of requesting them from those patients that require any support for long-term conditions. You could also be doing it for local and alternative services, and then alternative access during kind of intermittent weather issues, any snow or rainfall. And then also educating patients to kind of utilize the practice website and the other alternative options that are available on there. Again, we've added a link here for different text message examples that you can utilize, and we've also created some for those kind of clinical review long-term condition templates as well. Engaging your patients via your practice website is important. So we've created lots of different eConsult banners that are available. So if you wanted to push more for your patients to be utilizing the admin eConsult templates, for example, then you could add a specific admin template on your practice website alongside the standard eConsult one. We also have available banners for other type of conditions. So for those kind of long-term condition reviews, if you wanted to be pushing patients towards that. You can also kind of push patients to utilize other areas of the platform that we haven't highlighted. So for any travel vaccinations or any kind of other kind of blood test results, anything like that, it is available. And we can support with that if that would be of interest. Again, I've added the link here for those banners that are available. You may be interested as well in creating an announcement page on your website. So this can be a great way to get patients off the phone line and to stop you guys to have that conversation on repeat with patients. You may be wanting to signpost patients towards this specific area on your website where you can be educating patients on how to use the platform, and also more specific, so how to attach an image, the purpose of you guys requesting patients to use the eConsult platform, some of the benefits that are in place for the practice, but also for patients. And we've just added an example here of Hurley Group, who have made it super simple, but they've added some step-by-step instructions for how eConsult works. But again, we have created a guide for different examples for what this can look like, different text that you can add, different videos and images as well. So if that would be of interest, feel free to utilize the guide that's available. In regards to adding a telephone message on your practice phone line, This will be kind of the first main contact route for your patients. So having a clear message on there that you're asking your patients to use the eConsult platform is really important, and it will naturally increase patient awareness. It will also educate patients about these new processes that you have implemented in your practice. You can also be highlighting key information. So for example, you could be highlighting for those clinical e-consults, patients will be due a response by the end of the next working day. And for those admin e-consults, it is 3 working days, just to avoid any patients from calling the surgery and asking for any updates once submitting e-consults. Ultimately, it does reduce call volumes because patients are being told to go elsewhere, and they will then know that this platform is available to them. And it reduces the pressure on your call handlers. We are aware what patients can be like on the phone lines, so to avoid those conversations and just have a clear message telling patients that this is the alternative route is a great way to avoid those conversations to be had. And ultimately it offers patients an alternative option for accessing GP services. That's it in regards to marketing and also today's webinar. So now we'll have time for any questions and answers. So I will see if there are any in the chat. Not sure if there are.
Cara, there are no questions in the chat. So I think, like I said at the start, the invite for the webinar was sent out late last week. So thank you so much for those of you that were able to attend today. Any questions that come up, I'm going to, the follow-up email will be sent after this webinar, so you will have my contact details. In case you missed it as well, eConsult is free to you if you choose to come over. We're in the process of completing our contract with the ICB, and it's as simple as you letting us know that you want to start the process. I think you have till June, so there is time. If you, I know this, we're in the middle of almost at the end of the year, so it's quite busy, but we can just let me know, and then we can start the process sometime in April. So all that is left for us to do is to say thank you so much for your time. We're going to share the recording. Feel free to share with your colleagues, and please come back to me if you have any questions. My job is to help you implement and you use eConsult in a way that benefits your practice. You can literally come back to me in a month and say, Stella, you said. I will be very happy to have that conversation because I've seen it time and time again. It works in other places. Thank you so much for your time, and see you next time. Bye-bye.
Thanks, everyone.